all about period blood color. What the color of your period means. Have you ever wondered why menstrual blood comes in different colors? Just like changes in the consistency of your discharge, variations in the color of your period blood are perfectly normal. Understanding what each color means can help you to better understand your body and detect any potential health issues. Highlights. Blood is typically associated with the color red, but menstrual blood can vary in color. Normal menstrual blood colors include black, brown, dark and bright reds, pink and orange. Certain colors can indicate problems, such as infections or miscarriage. Seek medical advice immediately if experiencing orange or gray discharge. It is normal for period blood to change color, depending on the stage of the menstrual cycle. Bleeding after a period should be checked by a doctor if accompanied by symptoms such as clots, fever or heavy flow. We've always associated blood with the color red, but how come the rules are different with menstrual blood? You may notice the blood changes color all the time, but don't worry, because just like how it's normal for your discharge to have different consistencies, it's also normal for your period blood to be in various hues. Understand your body and live in sync with your cycle. Why does period blood have different colors? Period blood color can be a source of vital health information. It can tell you of your state of reproductive health, whether you're healthy or you got an infection or hormonal imbalance. But most of the time, the color just tells you how long the period blood has been in the uterus. What is the normal period blood color? There is no single standard color for period blood. As you change your pad or tampon, you may notice the blood changes color all the time. But don't worry, because just like how it's normal for your discharge to have different consistencies, it's also normal for your period blood to be in various hues. Understand your body and live in sync with your cycle. Why does period blood have different colors? Period blood color can be a source of vital health information. It can tell you of your state of reproductive health, whether you're healthy or you got an infection or hormonal imbalance. But most of the time, the color just tells you how long the period blood has been in the uterus. What is the normal period blood color? There is no single standard color for period blood. It can vary daily during menstruation and even across your whole cycle. Here's what the different colors of your menstrual blood may mean. Period blood color. Black. Black fluid resembling coffee grounds coming out of your vagina may sound alarming, but not when it's period blood. As surprising as it may be, black period blood is actually normal. It just means the blood has had time to be oxidized, giving it a darker color. Think of it as apple slices left to air out. Its color may change, but it's still okay. But sometimes, black blood can also indicate a blockage to menstrual blood flow. Consult your healthcare provider if you're also experiencing a foul-smelling discharge, fever, itching or swelling, or difficulty in urination on top of your black blood. Brown. Like black blood during menstruation, brown period blood is also nothing to worry about. It can happen for the same reason, but between the two, brown blood is relatively more common. Apart from oxidation, you may also experience it at the beginning and end of your period. When your period is about to end, the flow slows down, so it takes longer for your body to expel all the blood. Generally, black, brown, and dark and bright reds are simply period blood at different oxidation states. Meanwhile, pink and orange blood are usually period blood mixed with cervical fluid. Is it normal for period blood to change color? Yes. As we've discussed in the previous section, your menstrual blood will never be just one color for the entire cycle. So color changes shouldn't raise a red flag. At the start of your period and during your heaviest days, your period is likely to be bright red because the blood has no time to oxidize. When you lie down for a long time, you may notice dark red blood on your pads or tampons because it has oxidized a little. But certain colors can also be a sign that something's wrong, especially when it's accompanied by other symptoms. Knowing when to go to the doctor is important to keep yourself healthy and prevent potential health complications. When should you see your doctor? Black, brown, and shades of red are nothing to be worried about. As we've mentioned, the color of your period blood varies, depending on where you are in your menstrual cycle, but for orange and grey discharge, seek the advice of a healthcare provider immediately because it may indicate some form of infection. You should also be concerned if you're experiencing bleeding after your period. Pay attention to these symptoms as well. Blood clots at least the size of a quarter, excessively heavy menstrual bleeding that may come with blood clots, prolonged bleeding 4 days during periods, thick grey or white vaginal discharge, foul-smelling discharge, itching around the vagina, bleeding for an entire month, bleeding after menopause, extremely painful cramping during periods, fever, heavier or lighter menstrual flow, missing 3 or more periods, irregular periods when you were fairly regular before. Your doctor will rule out potential problems to try to zero in on a diagnosis. First, they'll ask about any medical conditions you have and the medications you're taking. They may also recommend a transvaginal ultrasound to see if abnormal growths may be causing issues. Depending on their assessment, your healthcare provider may also run further tests and propose a treatment plan to address the diagnosed problem. But unless you're exhibiting serious symptoms, chances are you're only experiencing a regular menstrual cycle. Conclusion: your period blood color can reveal a lot about your menstrual cycle and reproductive health. While it's normal for the color to change throughout your cycle, some colors may indicate underlying issues. Black and brown blood are typically harmless and occur due to oxidation and slower flow. Dark red blood indicates blood that has been in the uterus for a while, while bright red blood signifies fresh shedding of the uterine lining. Pink and orange blood may occur during the beginning or end of your cycle and can be associated with hormonal changes or infections. Grey or off-white blood is a sign of infection and should be addressed immediately. If you experience any unusual colors accompanied by concerning symptoms, it's important to consult your healthcare provider for a thorough evaluation. Like, subscribe and follow My Health by Dr. J for more health videos. Thank you for watching. Bye.